Thank you very much. I'm going to focus mainly on hospital. What are the problems that hospitals are facing with the products doing at the national level? And my first gauche slide, that is not here, I was pointing three main limitations. The first one is that there is a mismatch on assessment priorities. Hospitals are the main entrance of health technologies, and there are a lot of technologies that are very relevant to be assessed at hospital level that national agencies are not facing it. For example, there are usually at national level more drugs than medical equipment assessed. For sure, drugs is a very important part of the budget of the hospital, but there are a lot of medical equipments and procedures that enter every year in hospitals, and they need to do investment decisions. And especially, moreover, when national health agencies assess technologies, they assess big-ticket technologies. But remember, in a hospital, there are a lot of medium and low medical equipment that really in the aggregate can make a burden of investment for the hospital, and there is not information there about this type of technologies. Another issue related to that is the lack of information on very innovative technologies. So for a lot of technologies, especially personalized medicine, the localization technologies, orphan drugs, there is not almost methodologies or information out there for us, and especially for teaching hospitals, very innovative hospital, our doctors try to introduce these technologies very, very frequently, and we don't have information. The second problem limitation we have is that there is a mismatch also in HTAI content needs. What I'm saying about that? Usually, the weights given to assessment criteria, the weights given, differs between hospital decision makers and national decision makers. For example, the CEO of my hospital is much more interested in budget impact analysis than in cost effectiveness analysis. For sure, that cost effectiveness analysis is interesting to know what's going on, but he wants to know how this technology is going to impact into my process of care. And also, national reports, yes, they are quite generalistic assessing. What I'm meaning about that? In the hospital, it's very important that when you scope, you make the scope of the technology. I'm talking about the PICO, patient intervention comparator outcome. The comparator should be the standard of care in my hospital. That could be different from another hospital care, the procedure we are comparing with. Also, all these issue-related organizational impact are very important to be contextualized in the hospital, and national HTA's reports don't do this local approach. The third problem we face, decision makers in my hospital face, and they ask me, and I don't know how to solve that, is one thing that Calypso have already pointed out. This is this investment and coverage need. So we, the hospitals, also have a budget. And so, as we always say, one in, one out. And my CEO is asking me, okay, this seems good, but how I'm going to pay for that, what we can just retrieve. And I know that we in the HTA community talk a lot about this investment. There are some tools already developed, but there is not explicit information on what technologies should be retrieved from the system. So, my second gauche slide. What are the changes or needs, the needs we as a hospital really need? One thing is a more pragmatic involvement of hospital managers and clinicians in defining priorities for assessment technologies. I know that a lot of HTA organizations around the world have some systems for prioritizing technologies, but frequently they are quite academic and less pragmatic, and we need to involve more these profiles of people there. Second, I think it is need a better tailored early assessment of health technologies. So I know also that Euroscan is doing a very good job with early assessment of technologies, but the products of Euroscan focus mainly in clinical studies, phase 1, phase 2, and they don't take into account some information needs from CEO. For example, how this technology is going to impact in my process of care, and if there is other technologies that are there and coming out that can interface with this technology. And this is very important because remember, some hospitals are paid through budgeting schemes, and some of them, they are allowed to introduce this so innovative technology, especially teaching hospitals that want to be the first ones. And I'm advocating here, and I'm not as biased at all, as to promote the creation of units of programs of hospital-based HTA. I think they are very relevant and very important. And when I'm saying that, it's not just an isolated mushroom. These HTA units in hospitals should collaborate with national programs because both has their aims, are their strengths, and I think it's a win-to-win strategy. The third trend or need could be evolve the science of HTA on these very innovative technologies, what I call personalized medicine, orphan drugs, patient delocalization technologies. We need from the HTA community more development of methodologies. Fourth, give stratified HTA results. When you do these national big reports, please take into account different organizational structures, different implications, not just look at the overall, look at different situations, and it could be good also to have budget impact analysis there. And finally, I think that we need a comprehensive and systematic and specific information regarding this investment. Please do a step forward and just identify, point out what technology should we retrieve from the market. This is all.